That's not right at all, man. Oh, that's messed up. Oh my gosh. That is not right at all. What up, my dudes? Mr. Kitty here. Welcome back to Surgeon Simulator. We're gonna go right into another one. And for fair warning, I really mean this. Anybody who's easily cringed out by things probably should not watch this, because this is the... oh, jeez. This is the eye transplant. Oh. Well, if fair warning, so just now, take the time, if you're a cringe person, easily cringed out by things, just don't, I'm not going to be offended if you don't watch, so take the leave now. You've been warned. Okay. Alright. Perform eye transplant. Oh, dear. Okay. Well, there's the eyeballs. Now, what do we need to do is the $1,000,000 question. I take it we got to pull the... do we got to pull the mask off his head, I presume? I presume we got to pull the mask off his head. And he is knocked out. He is seeing all sorts of stars. Oh, we got... I thought we had something. How in the world are we even going to do this? Alright. Yank. I got a hold of his head. And yank it. Oh, do I got to break the... oh, I have to break the... I got to break it. The goggles. Oh, there goes my scissors. Oh, jeez. Well, we're off to a great start. Is this even... what does this even do anyway? I have no clue what this even does. I don't know what this tool is. I don't know what this tool does. Okay, so that obviously is not going to work. Okay. Let's see. The one time where potentially the hammer to the face might be the best bet. This is just... oh, okay. Tilt up. Can we go down a bit? Down a bit. Bang the goggles. Bang the goggles. Just bang the goggles. This is... this ain't right. Oh, we got one broken. Oh my god. Use the back part of the hammer? My goodness, this is... oh, geez, stop just wailing him in the face. My gosh, this is... okay, we got more broken. There we go. Alright, so I'm just going to set this right there. Let's get his head in a reasonable position. I don't even know what we got to do to even get the eyes out. I'm remotely just completely scared of what we have to do for that, because I don't know what to do. I didn't even know, honestly, this was even in the game, for that matter. I had no idea that the eye surgery was even in here. Oh boy. Well, let's just go. I don't even know. What do we got to do to get those eyes out? Because those eyes can't stay in here. Oh my gosh. Oh, we have to shave him? Oh, we got to shave him for some reason. Okay, this is a shaver. Alright, well I guess that... why would I need to shave his eyebrows though? This is ridiculous. Why do I need to do that? Is his eyebrows going to be in the way? Okay, we get the... well, this is just... this doesn't make any sense. None of this makes sense. Why would you need to do this on the patient? Why would you have to do this? Why would you have to shave off the eyebrow? They're not even close to the eyes. Why would you have to do... I could understand like the eyelashes, you know. You don't want eyelashes, you know, getting in the patient's eye, you know, or something like that in case you screw up. So I guess I don't know what I'm talking about. But this is just weird. Is that enough? I don't know if that's enough. What do I even got to do now? I wouldn't even know. Do I take scissors to his face? Do I take a knife to his eyes? Like, I honestly don't know. Okay. I guess we'll just have to grab a knife here. Or we can grab a pair of tweezers, I guess. Oh, gosh, people, I'm sorry for this, but this is the only thing I can think of to do. Nope. That's not that one. Okay, maybe a knife? Okay, this is gonna be even more cringy. Oh, boy. Oh, I'm sorry. Oh my gosh. Oh, why? Why are we doing this? Oh, why? Why are we doing this? Why? Why? It's stuck in his face. Oh my gosh. Okay, well, that wasn't gonna work ever. He really needs a needle of something. And we got it out. How did we get it out? Get out of the beaker. Thank you. Now let's just do this in the reasonable position and stab. There we go. Okay. And let go. Okay. There's got to be a better way for this. Because there's no way that taking a knife to the face is ever going to be the right decision for taking eyeballs out. Not a pen either. We don't need a pen for this. I don't need to write anything down for any of this other than to take notes on to never do this ever in my life. Why anybody would want to do... Well, that just is not the right way to do that. Why anybody would need to do an eye transplant, I have no idea. Why anyone would need to do this, I cannot think of a reason why, other than maybe if you didn't have eyes, I guess, but that would be the only thing I could think of. Okay, do I even have a hold of these scissors? I don't even have a proper hold on these scissors. Can I hold these scissors in a reasonable fashion? Is that a thing that I can do? Okay. Oh, man, I'm so sorry, buddy. I apologize. Oh my gosh, this is the only thing I can think to do because I don't know what to do. Oh my gosh, this is just not. This is not the way to do this. I don't think. Okay, that's not the way to do that. Can I pull this thing off his head and go through that way? Nope. There is no other proper way to do this, and I have no clue. Do I gotta take his... What do I even... I don't even know. Is there anything... Dude, I don't know. Like, I don't feel like anything I'm doing is right. I'm just... Nothing feels right. Why you would need to... Well, that's a better way to hold this. Let me try again. Let me just stab him in the face. Stab him. Stab him in the face. Oh my god. This ain't even right, man. There's no way that any of this is right remotely. Okay, none of this is right. Alright, so I'm back. And I looked up the wiki on how to do this. One, I learned the patient's name was Bob. And two, this is a particular way to do this. It's not the way I would have thought to even remotely try to do this. But basically, what you got to do is basically, like I was doing before, just incoherently stabbing the eyes, and then somehow you got to get them to pop out by basically punching them in the side of the face. So we are going to... We could break the goggles off, but I'm going to try to cut the goggles off because that was one of the things it said to try and do, was to cut the goggles off. And we are going to be very gingerly with how we do this. Very careful. Oh, there we go. That was a little bit easier. Okay, now since he's bleeding out, I want to be sure that I'm doing poor Bob right. And don't fall off the table, please. No! we're going to act like that didn't happen. Okay. So, go here. We're going to cut these, and the scissors just fell on his lap again. Great. Great. Absolutely fantastic. That's just lovely. Although I probably might not even need the scissors for anything, in all honesty. So, we're going to cut these goggles off. Once again. Come on, just cut the goggles off. There we go. Okay, now, when we reach for this, let's not be an idiot and knock it off the table. So let's at least do that. Did I break the needle? Oh, I thought I broke the needle off it there for a second. Reach for that one. Oh. I got a hold of something. There we go. And stab. Right in the face. Okay. Beautiful. Alright. So, now we need to continue what I was doing before I decided to creep out. This apparently was the right thing to do, was to gouge the eyes out with something. So we're going to go in. We're going to stab the eyes. Guess this is just why you would even need to do this. Okay. Now, go to the other eye. I think we did fine. So, just go in. Okay. Now, we need to punch him in the side of the face somehow. I think. That's basically what I look to do. Jeez Christ. I am just wailing on this poor man. But this apparently was how you got the eyes to knock out. My gosh. Okay, that didn't work. What about with the hammer? Oh my God. This is brutal. Why is surgery so brutal? Is this how surgery is in real life? My gosh. Just whack out of the head. My gosh. This poor man. I am so sorry, Bob. Bob, I apologize. But we still require you to pay for your bill when we're through here. So, no exceptions. My gosh, this is just brutal. Jeez, man, this is ridiculous. Why anybody would need to do this is absolutely stupid. All for an eye transplant, which makes no sense at all. Man, make me not want to get an eye transplant ever. Okay, maybe I didn't gouge the eyes out enough? I don't know. I promise this is what it said to do, but my gosh, this is awful. There's no reason to do any of this. Oh, that one definitely went in a lot further than the other one the last time I did it. So, oh my gosh, it's just freaking brutal. Okay, we need to get the needle again for this guy. This is absolutely insanely brutal, man. This is stab again. Just stab him again. There we go. My goodness, this is terrible. This is absolutely terrible. Why you would need to do this to anybody, any doctor in America today, heck, anywhere in the world, would get fired for this. This is not good practice. This is not good practice at all. This is horrible. Anyone in their right mind who would be okay with this should not be a doctor. I'm just thankful this is a video game. My gosh. This dude's gonna die not of blood loss. He's gonna die of a freaking concussion. My gosh. Even if he dies, I don't even care, because this is downright awful. My gosh. He's gonna die anyway, so... Good night. This is sickening. This is downright sickening. I'm questioning if even I want to put this on the channel, man. This is just... This is grotesque and just wrong. We're going to try this again, I guess. We're just going to beat the mask off his head, I guess. He's already going to get his face pounded to bloody pulp enough. Might as well make it worth it. Here we go again. I'm going to go stab his eyes out. Because, you know, that's what it said. So, that's what the wiki said to do. So, we're doing it. Ugh. I tell you, like I said in the last, before I ended the video in the last one, I am not... I hate anything like this. Oh! No! What the heck? What the heck? Why? Why? Why is... Why? Why is it stuck in his face? Of all the things, why did it have to get stuck in his eye? Why is it stuck in his eyeball like that? No! Oh, that just ain't right. Oh, that's not right. Oh, that ain't right. Oh, that's not right at all, man. Oh, that's messed up. Oh, my gosh. That is not right at all. Oh, my gosh. I can't handle this. This is disgusting. Oh, my gosh. Yet I'm still watching it work as I have to. Oh, come on. Would you do... And I'm sitting here just like, come on, get it in the eyeball already. My God. Dude, this is disgusting. This is disgusting. This is absolutely disgusting. Come on. I never wanted something to get stuck in someone's eye so badly. My gosh. Just get in the eyeball. How did that one get in the eyeball? I didn't even know. Just get in there already. Okay, let me try a different... Okay, the patient's bleeding out once again profusely because we keep stabbing his eyeballs with knives. So what do you think's going to happen? I can't right now, man. This is just morbidly disgusting. Just grab the freaking needle already. Would you please grab it? Grab the freaking needle. Would you grab... Okay, that's not how you grab a needle, but, I mean, I'll take it. I mean... My gosh. This is wrong. This ain't even right, man. Let's get this one out of the way, because that one most certainly didn't work. Let me grab one of the... Oh, I had one. God dang it. Not the tweezers. I don't want the tweezers. There. Take that and take this knife and take the knife. There we go. Okay, take the knife. See, that's proper positioning for a scalpel. Not whatever. Would you... Oh my gosh, man. This is grotesque and disgusting. Why do I have to do this? To even move on to the other ones, I have to do this. This is wrong. Absolutely wrong and grotesque. This is sickening. I hate this so much. There we go. It's stuck in his eye. Do I have to pull it out now? Oh my gosh. Pull out already. Oh, that's just disgusting, man. Oh, man. And it's popped out. Okay. So I understand now what I have to do. Okay, so now stab it. Did you stab the needle in his skin? There we go. Gosh, that was deep too. Okay, just now go in and grab firmly grasp. Would you firmly grasp the frickin' knife? There we go. My gosh. Okay, we have a blunt object. I don't care that it's an axe. Just whack him in the face. Just whack him in the face. Okay. And he's gonna die. He's going to die. Because we were whacking him in the face with an axe. He's gonna die. He's definitely gonna die. Okay, that's not gonna work either. Let's try closed-fisted. Just can we just punch him in the face? Ooh, we got one. And we got two. Okay. We need to be very careful. because he is going to, I feel like he's probably going to die. We're so close now, so I would rather not have that, in all honesty. Just sever the eye. Just sever the eye. Looking at that's so gross. Trying to be very careful as to how we cut, because I don't want to kill him. I don't want to kill Bob. He's going to die. There's just no ifs, ands, or buts about it. Yep. Gosh dang it. Okay. Well, I don't know if I can finish this one tonight. That's just, oh. Man, that's just, I am grossed out completely. That is so disgusting. I joke you not, anything with eye stuff, like having the thought of just like a needle to the eye, or even with like anything with like LASIK surgery, anything eye related, it just absolutely freaks me out. I can't handle it. The thought of it just freaks me out. And I think for tonight, I think I'm going to try this another time. I get the idea of how to do it. It's just actually doing it. So I'm gonna give this another shot later. I'm gonna go watch some puppy videos or some kitten videos and just cute out over that. So my goodness, man, this is just gross, man. So I'm gonna go ahead and leave this here for now. I'll come back to this here at a future time, but and give it another go. It might be on my own time. It probably is for the best to do it on my own time. So thank you very much for watching. Let me know what you think of this, and I will see you in the next one. Deuces.